You've heard it said, health is wealth, so enrich your life with the Healthy Home Hour, brought to you by the Healthy Home Market every Sunday, 9 to 10 a.m. Know what's new and classic for health and wellness. Meet the local and national experts. Live God's plan to thrive, not just survive. I'm your host, Holly Adams, and welcome to the Healthy Home Hour. Morning all, glad you're here this Healthy Home Hour for some solid info on wellness, prevention, and self-empowerment. As usual on Sundays at 9 to 10. And today we're talking about caring and the partnership that keeps you and yours well. Caring as in health care. Everyone knows by now, really, we all know that prevention is key, but it's not just about eating right and juicing and taking your vitamins and getting to yoga or Zumba class. You know, we talk a lot about how to work your wellness on this show, brought to you by the Healthy Home Market. But man, if you need a doctor, you really need a doctor, and as we often say, it's good to check with your doctor too when adding herbs and supplements to your meds. But that brings up a serious point. How can you see or talk to your doc for seemingly simple things? Because you know, those deductibles on the insurance, they're just not in the budget a lot of the time. And what insurance do you have? What keeps you well? Does your insurance keep you well? So to talk smart about this massive issue, our guest today is Jessica Schorr Saxe, MD, or some of you know her as Dr. Saxe. Dr. Saxe is a family physician and worked in Charlotte for upwards of, I think, even over 30 years with folks that were underserved, which seems like a lot of us, actually. Now she's currently the chair or leader of Health Care Justice North Carolina. That's right, we're talking health justice today. Dr. Saxe writes frequently for the Charlotte Observer. In fact, she wrote an article this week in the Observer that you can check out, and is very active in our community. Dr. Saxe has won awards after awards, including the Council for Children's Rights, the Dolly Award, the YWCA Woman of Achievement, and the President's Award from the Mecklenburg County Medical Society. And I am so stoked that Dr. Saxe is here today. We've got a lot to talk about. Welcome, Dr. Saxe.
Thank you so much, Holly. It's so good to be here this morning.
It's a pleasure. Dr. Saxe, you know, it's hard, Dr. Saxe, staying well. We know it's a personal responsibility, but it can't be done alone. So aside from family and, you know, folks need mentors, coaches, and good doctors and access to doctors. What has happened to our medical system? Why is it so expensive to get adequate care?
Well, first of all, I want to thank you for starting this out and saying that we're here to talk about caring, because really there is care in healthcare, and that's what it really should be all about. The answer to why it's gotten expensive is a very complicated answer. It's gotten expensive over a long time.
Right.
There are several things that make healthcare so expensive in this country. And by the way, it is way more expensive than in other countries. If you look at most developed countries, our healthcare costs about twice as much per person as most developed countries. And in those countries, everyone is covered, whereas in our country it is not. And there are a few major reasons for that. One big reason, believe it or not, is our bureaucracy.
Isn't that amazing when we proudly talk about not having a bureaucracy?
Yes, thank you. You picked up on that. Yes, our healthcare bureaucracy is much worse than in most other countries. We spend much more on administrative costs, like about twice as much as Canada. Our administrative costs are almost a third of what we spend on health care. And in Canada, they're about 16%. And I want to point out, I don't think I have to point out to you that bureaucracy is expensive, but all that bureaucracy really interferes with people's lives, both of patients who go crazy trying to figure out their bills and everything, and also as a person who is a practicing physician, I can tell you that it drives doctors crazy. So that's one reason. And then there are some other reasons, like we have a lot of high-tech things that we spend a lot on. We spend way more on drugs than people in other countries, and a lot of our services are more expensive.
I'm glad you brought up the technology piece, because it seems like, I remember as a kid, I used to go to the doctor, and I had the same doctor up until I got into my teenage years. And, there wasn't the technology, but there was a real sense of him seeing me and seeing what I needed. But he didn't have all the bells and whistles, and I made it through childhood, luckily, as came to be a healthy adult, more or less. So speak a little bit to the technology piece, because we seem to pride ourselves on that, but it doesn't seem like it's working altogether.
Right. Technology is very important when you need it. But a lot of technology in this country is used without benefiting anybody. And, and that's one of the problems, is that it needs to be appropriately used. And individuals need to realize that the answer to their problems is not always technology, but it's not just an individual responsibility. Doctors need to realize that. We need to be careful about ordering tests and so on. But you're very right that a lot of people can make it all the way through childhood and through much of adulthood without a lot of exposure to technology.
Are the hospitals kind of seduced by technology?
Oh, yes, I think so.
Yeah. It's said that actually, I think it's 78%. As I was preparing for today, I discovered that it was 78% of people go into bankruptcy because of medical bills, and that 60% of folks are actually even have private health insurance. Explain, for those of us who don't know exactly, what's the difference between the two? Why are they so inadequate either way, private or public?
Okay, and if you don't mind, let me correct that a little bit, which is, so now we're talking about one of the group of people who suffer from medical bills in this country when you talk about medical bankruptcies. So about 1 in 3 people in this country has some kind of serious problem with medical bills. And the largest reason for personal bankruptcy in this country is medical bills. And if you look at the people who suffer bankruptcy, medical bankruptcy, it was a surprise to me, and I think it would probably be a surprise to most people, to realize that the majority of them had health insurance when they got their illness. That's the 78%.
Okay.
78% of people who declare bankruptcy because of medical bills were not uninsured. They started out with health insurance. And of those, 60% had private insurance. So what you're leading to is the question of why even people who have insurance and who have private insurance have these problems with medical bills.
Thank you. Yes. Well said.
Okay. So let me say something now about this in the era of the Affordable Care Act, which is a really important point. You haven't raised the Affordable Care Act yet, but
we were going to go there. But you do.
But what I'll say is, we can talk. Obviously, the Affordable Care Act has a number of benefits, including getting more people insured. And then there are some other benefits to the act, like its emphasis on prevention and so on. One of its shortcomings is that it still leaves people uninsured, millions of people uninsured. But another shortcoming that I think people are beginning to realize, but haven't really focused on, is the issue of underinsurance. And that's what you're getting at with the question of medical bankruptcy. So underinsurance applies to people who have health insurance, and most of whom think that they're probably protected.
Right.
But who then find either they have an illness and they find out that they can't afford it, or they're at risk. I mean, they may not even realize that they're at risk. But what the shortcoming of insurance is, and especially in this era in which now more and more people have high deductibles, is that people have these premiums, they pay their premiums, and then many people have a deductible that's like $5,000. So then they get sick, and they're still paying off their deductible. They haven't gotten to their deductible. Well, most Americans don't have that kind of money accessible to them to pay that $5,000 before their insurance kicks in. So what some people do, some people just don't get care that they need if they see that they can't pay it. But then other people, who are very sick, go ahead, get the care, and then they find themselves in the position of having bills that they can't afford. And some of those lead to medical bankruptcy. Some of them lead to other kinds of problems.
Well, and that is such a serious problem, and it's so common. And there's stats out there that say that 52% of Americans are making under $30,000 a year. So that's over half the population that is susceptible to bankruptcy so easily. It's not something that's uncommon.
Well, that's right. And it's not only lower income individuals who are in that position. There are people who feel that they're quite comfortable, who still can't afford very large medical bills if they get sick.
We lead, and you alluded to it before, even though we pay so much, you mentioned it, we pay so much in healthcare bills, and we really don't get, the juice isn't worth the squeeze, as they say, because compared to the other industrialized nations, the preventable deaths are higher, infant mortality rates are higher, and I'm wondering, as chair of Healthcare Justice North Carolina, which is, I should say, the state chapter of the state and local chapter of Physicians for a National Healthcare Program, what do you and other forward-thinking physicians see as a way to solve this big, scary national problem?
Okay, let me say thank you for Healthcare Justice North Carolina is really the kind of local chapter. There's another state chapter, Healthcare for All North Carolina. Just want to let you know we have 2 large chapters in North Carolina. So, yes, what we propose as a solution is that the United States adopt what's called a single-payer healthcare system, which would be like improved and expanded Medicare for all. And this is a very timely question because this is the 50th anniversary of the Medicare legislation, which was signed into being on July 30th, 1965 by Lyndon Johnson. And the idea, actually, when Medicare was proposed, was the people who were in favor of it didn't view it as stopping with seniors. The idea was that it would be started with seniors who were at a particular risk at that time because many of them were uninsured. Almost half of people over 65 were uninsured at that time because people were younger people. Many of them were insured through their employers, but this was obviously a group that was at risk. They were uninsured and they were older, and a lot of them had health conditions. So the idea is that we would start by protecting the seniors, and then we would expand it to the rest of the population. Well, thus far, many people have worked on that over the years. Thus far, that hasn't happened.
Well, let's back up a minute. What happened? Why didn't it continue on through the population?
Politics.
Okay. Yep.
To sum it up, at various times people have brought it up. There's been various opposition. The American Medical Society Association opposed it strongly at various times. It's a long political story about why it hasn't happened till now. But there are many of us who would like to see a program like Medicare extended to everybody. They're not exactly as Medicare is now. It would need some improvements, and then obviously it would also need to cover everyone.
Yes, there's a lot to talk about with this, and I'm really glad you're here today to tell us about it and share and educate us. We're going to be right back, folks. We're here with Dr. Jessica Saxe talking about so many things about your health as it pertains to health insurance, and happy anniversary to the Medicare program, which was this past Thursday on the 30th. So we'll be right back. We are here listening to Streets 103.3, Charlotte's new hip-hop station.
Did you know that your liver performs close to 500 vital functions, including filtering out all of the environmental toxins you're exposed to every day? For the health of your liver, Himalaya Herbal Healthcare offers Liver Care, a clinically proven combination of nourishing herbs that helps cleanse, as well as normal cell regeneration and enzyme levels. And when compared to seasonal cleanse kits, Liver Care offers daily support. You'll find Liver Care at fine health food stores everywhere and online at HimalayaUSA.com.
You want more protein for your workout, for you, for your family, so you eat a protein bar. You mix up a protein shake. But did you know your liver plays an essential role in creating new protein in your body? And Liver Care by Himalaya Herbal Healthcare has been clinically studied to decrease nitrogen loss. And nitrogen is the glue your body uses to make new protein. Liver Care keeps you and your body in a protein-creative state, so you get the full benefit of those bars and shakes. Liver Care by Himalaya Herbal Healthcare.
We face many of the same challenging situations every day, and Stress Care is your way to move through the day without the occasional stress, fatigue, and frustration that can happen when there is just too much going on. Stress Care contains the world's most prized adaptogens, ashwagandha, holy basil, and turmeric, and is clinically proven to effectively promote both peace of mind and vitality. We like to describe Stress Care by saying, same situation, different you. Stress Care can be found at fine health food stores everywhere or online at HimalayaUSA.com.
Novocaine, baby, Novocaine, baby.
Hey, we're back. You're listening to the Healthy Home Hour. I'm your host, Holly Adams, and we're here with Dr. Jessica Saxe talking about healthcare. Your healthcare and what we can do to improve it. And she's the chair of Healthcare Justice North Carolina. And before we get back with Dr. Saxe, I just want to tell you what's happening at the Healthy Home Market this week in the community room at the Plaza Midwood store. Starting tomorrow on Monday, there's a really cool class called Great Ferments and Your Fantastic Gut. It starts at 6:30 to 8. That's in the Community Wellness Center behind the store, there in sort of the back of the parking lot at 1330 Central Avenue. And on Tuesday, there's a class entitled It's Not All in Your Head, It's Also in Your Gut with Teresa of Simply Healthy. That's 7 to 8-ish, depending on, we can go till 9 with your questions, I'm told. So that's some of what's going on this week. Coming up at the Healthy Home Market. Of course, you can check it out by going to www.healthyhomemkt.com. That's healthyhomemkt.com. So, Dr. Saxe, we're on a big subject here. And we were just talking about the 50th anniversary of Medicare Pass this week. And I was wondering if you would tell us, so people have an idea what it might have been like beforehand. Because it's been around for a long time, for 50 years. But what was it like for seniors before there was Medicare?
Oh, yes. Thank you for asking that question. Medicare has been around for so long that people take it for granted. But before Medicare, as I mentioned earlier, almost half of seniors were uninsured. And they were all older. So a lot of them had health conditions, and a lot of them were at risk for not being able to get the care that they needed. I mean, what we can tell about the difference is that after Medicare was instituted, the number of seniors who didn't have insurance went down to about 2%. And what we saw was that more people had doctors, that more people were hospitalized. And there was an increase in life expectancy of about 5 years, some of which is thought to be 5 years at age 65. So the life expectancy for people who are 65 is now 5 years more than it was before. And much of that is attributed to Medicare. Now, I can also tell you that as a person who has elderly parents, it's hard for me to imagine how it was for younger people who had their own issues and their own families before the institution of Medicare to have parents who didn't have any health insurance.
Yeah, I can't imagine either.
You know, it's just, as I say, it's something that we've come to take for granted. Though, since the implementation of Medicare, the institution of Medicare, more people are covered, as I said, and they have better access to doctors. And it is a program that is very popular with the people who are on it. You know, people don't want to do away with it. And seniors find that it's more popular with the people on Medicare than private health insurance is to the people who get that.
That's very interesting. What about the people talk about the health supplement? Is that something that... Tell us about that a little bit, because there seems to be a few aspects to it.
Are you asking about like Medigap plans or?
Yeah, I mean, we're talking about right now, we were saying how, people like it, and then, they prefer it over private insurance. And then that there's also, you hear out on the street about there's sort of a supplemental insurance possibility.
Yeah. Well, so one of the things we were talking about earlier is how if we extended Medicare to everybody, we would have to make some improvements. And one thing about the Medicare program is it's not really just one program. It's several programs, and they're all funded differently and administered differently. So one of the improvements we would have to make would be to consolidate it. But just in short, Medicare Part A is hospitalization, and that's paid for through the Social Security system. And that everybody gets that at 65. Then there's Medicare Part B, which pays for outpatient for doctor visits, and that's optional, but there's a monthly payment for that. And then there's also C and D. D is the drug plan. But I think when you're asking about Medicare supplements, it's because Medicare doesn't, in fact, pay for everything. So people get other insurance to supplement it.
I see.
Again, if we had a program like Medicare for all of those things would be covered, so we wouldn't have all these different programs and different funding sources.
So you're talking about trying to get this done.
Right.
In not only the state of North Carolina, but throughout the country.
Correct.
And when you say improving it, that's what you're speaking of.
Well, there's several things.
Okay.
One would be to consolidate it. And another thing about improving it would be to make it more comprehensive, because current Medicare doesn't cover everything.
Some people get kind of crazy when you talk about this. They say, oh, well, that would be socialized medicine. And people get very nervous about the idea of socialized medicine. What would you say to those folks?
I would say, relax. We're not talking about socialized medicine here. Socialized medicine is when the government owns the means of production, and it would mean that it would pay the salaries of doctors and so on. The National Health Service in England, you could consider socialized medicine. That is not what we are asking for or talking about here. What we are talking about is one payer, which would be the government or what's called a quasi-governmental agency, but there would be a single payer that would pay the bills, but the delivery system would still be private, just like it is now. We would have hospitals, we'd have private doctors' offices. And what would happen to make the payment more efficient is that all of those offices would file bills with the same entity. So it's one financing system, but privately delivered.
So you mentioned earlier that back when Medicare was started 50 years ago, that the AMA, the American Medical Association, balked at the idea of Medicare, that they didn't like the idea. Does this relate to the socialized medicine piece and the idea that there would be, it's sort of like a partnership of public and private? Is that a problem for the AMA?
Well, historically, Medicare was a problem. I think some of the arguments were probably some of the same things that we hear now about threats of a government takeover and so on. But it's kind of ironic. The AMA opposed it vehemently, and then doctors really benefited from Medicare. There were great increases in doctors' salaries after the implementation of Medicare because they started getting paid for people that they didn't used to get paid for, with everybody being covered.
Did you experience that when you said on the break that you retired from your regular practice this past February? Did you experience that? I mean, you weren't obviously practicing before it started, but did you find that people would not have come to see you if they didn't have Medicare?
Oh, in practice absolutely.
And I'm wondering, not only did they not come to see you for, a serious problem, but it seems as though not having insurance creates a way, with the deductibles and the expense of it all. People don't do the preventative care that we talk about so much on this show about. You can't really achieve wellness without having access to a doctor.
Oh, absolutely. And this is something I could spend the whole hour and more talking about. But let me give you an example of a patient that I saw. I saw a woman right after her 65th birthday, and she had not been, think she had not been my patient prior. It was her first visit to me, though she had been to the office before, but she'd only come in a couple of times in the years before. Well, she got her Medicare. She came in. She had kidney failure. She hadn't been to her kidney doctor because she couldn't afford it. And she was what we consider, if you looked at her, we would say, she also had diabetes. Her diabetes wasn't controlled. She was what we consider a non-compliant patient. Well, once she had Medicare, she came in. She went to her kidney doctor. Her kidney problems improved. We got her diabetes under control, and she started losing weight. We started talking about her weight. She started losing weight. She had some surgery that she had put off. She was able to get around better, and she was great, and she was happy. But this is a person, I kept thinking, this is a person that we just labeled a non-compliant patient. Well, she wasn't non-compliant. She just couldn't afford it. There's a lot of talk today about people taking personal responsibility for themselves, and people are always talking about the need to do that. Now, I'm a big personal responsibility person and personal responsibility doctor.
Right.
I was always talking to my patients about nutrition and physical activity and tobacco, smoking. And smoking is one good example. If a doctor talks to a patient about smoking cessation, it doubles their chances of successfully stopping.
Imagine that.
But you can only do that if they come see you.
Right.
I mean, if people are staying away because they can't afford it, they don't do that. And similarly with weight, I helped a lot of people lose weight, but I could only help them if they came to see me. So if we want people to take personal responsibility, I think it's really important for them to have access to medical help that helps direct them and encourage them and talk to them about doing that.
Yeah, that is the critical piece there. So thanks for being here again to tell us this. I'm very excited that you're here. We're going to keep at it, folks. We're going to talk some more with Dr. Saxe about how you can stay well and what is really going on in the insurance world and what we can do to change it with Healthcare Justice North Carolina. This is Streets 1033. We'll be right back.
Did you know that your liver performs close to 500 vital functions, including filtering out all of the environmental toxins you're exposed to every day? For the health of your liver, Himalaya Herbal Healthcare offers Liver Care, a clinically proven combination of nourishing herbs that helps cleanse as well as normal cell regeneration and enzyme levels. And when compared to seasonal cleanse kits, Liver Care offers daily support. You'll find Liver Care at fine health food stores everywhere and online at HimalayaUSA.com.
You want more protein for your workout, for you, for your family, so you eat a protein bar. You mix up a protein shake. But did you know your liver plays an essential role in creating new protein in your body? And Liver Care by Himalaya Herbal Healthcare has been clinically studied to decrease nitrogen loss. And nitrogen is the glue your body uses to make new protein. Liver Care keeps you and your body in a protein-creative state, so you get the full benefit of those bars and shakes. Liver Care by Himalaya Herbal Healthcare.
We face many of the same challenging situations every day, and Stress Care is your way to move through the day without the occasional stress, fatigue, and frustration that can happen when there is just too much going on. Stress Care contains the world's most prized adaptogens, ashwagandha, holy basil, and turmeric, and is clinically proven to effectively promote both peace of mind and vitality. We like to describe Stress Care by saying, same situation, different you. Stress Care can be found at fine health food stores everywhere or online at HimalayaUSA.com.
Novocaine, baby, baby. Novocaine, baby.
Okay, we're back. I'm Holly Adams. We're here with Dr. Jessica Saxe today of Healthcare Justice, North Carolina. And before we get back to our conversation, I just want to let you know that we got a few things happening at the Healthy Home Market in the Community Wellness Center. And next week, not this coming week, but next week, we've got a class called the Medicine Cabinet Makeover with Renee. That's 6:30 to 7:30. And then the following week, on the 20th, it's the usual third Thursday where you get vegan cuisine classes with Chef Ami L starting at 6 o'clock until, well, whenever you stop eating. There's samples and recipes and instruction, and everybody, lots of folks come out for that. It's a great time. So before the break, we were talking about so many things, and our topic for today is looking at insurance and the idea of a national healthcare system, which actually is summed up in two words: single payer. And Dr. Saxe, I want to ask you if that you know, the Affordable Care Act, it's here, it's gotten a lot of press, there's lots of folks on it. Isn't that supposed to cover just about everyone that needs insurance? Why are we still talking about the need for a single payer?
The idea of the Affordable Care Act was that it was supposed to move us toward universal coverage. But the act was never written so that every single person was covered at all. There are gaps in it. And so even if it had been implemented as it was written, there still would be over 20 million people in this country who don't have health insurance. Now, part of what has happened is that a number of those people were supposed to be covered by Medicaid expansion, and a number of states, including our own, did not vote to expand Medicaid. And so, for instance, in North Carolina, there are hundreds of thousands of people, of the poorest of the poor, who are not covered because Medicaid wasn't expanded and they don't qualify for anything else. And then there are a number of other people who are not covered under the Affordable Care Act. So again, you know, as I said earlier, that's one of the shortcomings of the Act. That's one of the reasons we're talking about single-payer health care. Another really major reason that I and our organization and many other people think that we need to think beyond the Affordable Care Act is because so many people who actually have insurance under the Affordable Care Act are, as we mentioned earlier, underinsured, and we need to address those needs as well so that we have everyone in the country not only covered, but actually with adequate coverage.
Right. And they're underinsured because of these high deductibles.
Well, yes, high deductibles, co-pays, because it's what's called cost sharing in insurance. There's so many costs that they have to share with their insurer that they are unaffordable to many people.
So it kind of begs the question, how will we pay for all this?
Great question. I'm so glad you asked. So I want to go back and remind you about all the excessive costs that we have in our system. And to just say again that the United States leads the world in what we pay for health care. We pay about twice as much as other countries. Okay, and even though all the other countries in the developed world cover everybody, so that might make you think that we have some money in our system that we could use on covering people. Another thing is our administrative costs are very high, and there are some other things that are very expensive in our system. Now, another point that I would make is that a large proportion of our healthcare system is actually done through public funding. I mean, we think of ourselves as being based on private health insurance and employer-based health insurance, but actually the proportion that's publicly funded goes up all the time, and it's more than half. I mean, if you think of programs like Medicare, Medicaid, the VA, all those things are publicly funded. And if you look at the amount of public money that we put in, just the public money, not the private money part, that is more per person than some countries spend on their entire systems. So you can kind of imagine if we had a system like one of these other countries, we could just take the public money that we have and we could fund covering everybody. If we eliminated insurance companies, which is where a lot of our healthcare spending goes, and really, what do we need them for? A lot of money is passing between us and insurance companies on the way to healthcare, but it's not delivering healthcare. If we eliminated insurance companies, we could use that money to actually deliver healthcare.
That's interesting because it's, there's a lot. In fact, in the media last week, there's been a couple of things I've seen about how since the Affordable Act came into being, that it's actually created a lot of mergers and happening within insurance companies and that between insurance companies, and that we may end up with just 3 insurance companies in the end, which almost sounds like it's getting to a single payer, but it's not really. Right?
Oh, right. It's not in that kind of way. I mean, it does make you ask the question, well, if there's so much benefit in consolidating and so on, wouldn't there be benefit in only having like one payer? And instead of having, these different insurance companies and they all have their different plans and different networks, and then if you change from one to another, then, people have to start all over, and there's all kinds of complexity. But the biggest difference between that and moving towards single payer is that these insurance companies are for profit. And what's their bottom line? Who are they trying to please? They're trying to please their investors. Whereas a single payer system that came through the government, nobody would be making a profit, and the responsibility would be toward the public and seeing that all the public get health care.
Would this affect, you think, I'm thinking of the things that are so expensive about getting health care, things like drugs, prescriptions, and medical equipment. They're wildly expensive. Would that change that?
Oh, absolutely. Because if you had one payer, then what they would do, like every other country does, is they would negotiate for the prices. They would negotiate with drug companies. They would negotiate with devices. Drug prices in this country are much higher than in other countries that do this. In a way, we're subsidizing the rest of the world.
So the single payer bill, there's something happening in Congress relating to that. I'm wondering who's putting it forward, who's sponsored it, and what's covered in the bill. It seems like that must be a pretty brave person.
Well, it's Congressman John Conyers from Detroit, and he's put this bill for every year for years and years and years. The bill is only 30 pages long, so you can read it at your leisure as opposed to some other things.
Now, is that on your website? Can someone read that on your website, or do you know the website where they can?
Yes, absolutely. So our website, I'm so glad you asked, is pnhphcjnc.org. Or you can just Google Healthcare Justice North Carolina and find it rather than remembering all of that.
Right.
We're a chapter of Physicians for a National Health Program, And there should be a link on our website to that, but I will also give you and our listeners that website, which is easier. That is pnhp.org, and they have the bill on their website. But since I think many listeners and possibly you won't actually read the bill.
Oh, 30 pages. I think I can handle it.
What I'll say is it outlines a number of things in the bill. It talks about what will be covered. Coverage is comprehensive. It's all kinds of basic health care needs, including mental health, including substance abuse, including dental care, devices, physical therapy, things like that. There are no premiums, copays, deductible. Everything it's called first dollar coverage. It's all covered. And then there are other things in the bill, like the funding mechanism is in the bill, and then there's allowance for a board that will govern this, that has public representation. I mean, that's, again, a big difference, and I don't think people realize between this proposal and insurance companies, which is, if you want to know who's responsible for this, or if something goes wrong, there's public representation for this. There are physician experts who would be on the board. There is consumer representation, and all these people have ownership. If your insurance company makes a decision that you don't like, you're not represented there.
That's true. I can't tell you how many hours that I have clocked on the phone talking to my insurance company, and I'm not alone. People talk about it all the time. If we could add up all those hours, that's another expense that people are not at work, not doing what they can to earn money in whatever capacity they do that, because they're on the phone trying to solve these problems.
Oh, and I'm very familiar with that.
I bet
from
you
my
are.
well, not just from being a physician and having patients, but with my own experiences with insurance and being on the phone. So I understand that if you're a patient in France or in Canada, that what you do when you go to your doctor's office is that you show them your card, which is kind of like looks like a credit card or something, and they swipe your card, and that's it. You don't ever see a bill. It's all taken care of. And, I do think not only of the money that would be saved, but all the aggravation that we've all invested in this.
Yeah, it's an incredible concept to just think about. It's so freeing. And we're going to take a little break. We'll be right back. We're going to talk some more about that very thing and other things. Stay with us, folks. You're listening to Dr. Jessica Schorr Saxe, and you're here on the Healthy Home Hour, Streets 1033.
Did you know that your liver performs close to 500 vital functions, including filtering out all of the environmental toxins you're exposed to every day? For the health of your liver, Himalaya Herbal Healthcare offers Liver Care, a clinically proven combination of nourishing herbs that helps cleanse, as well as normal cell regeneration and enzyme levels. And when compared to seasonal cleanse kits, Liver Care offers daily support. You'll find Liver Care at fine health food stores everywhere, and online at HimalayaUSA.com.
You want more protein for your workout, for you, for your family, so you eat a protein bar. You mix up a protein shake. But did you know your liver plays an essential role in creating new protein in your body? And Liver Care by Himalaya Herbal Healthcare has been clinically studied to decrease nitrogen loss. And nitrogen is the glue your body uses to make new protein. Liver Care keeps you and your body in a protein-creative state, so you get the full benefit of those bars and shakes. Liver Care by Himalaya Herbal Healthcare.
We face many of the same challenging situations every day, and Stress Care is your way to move through the day without the occasional stress, fatigue, and frustration that can happen when there is just too much going on. Stress Care contains the world's most prized adaptogens, ashwagandha, holy basil, and turmeric, and is clinically proven to effectively promote both peace of mind and vitality. We like to describe Stress Care by saying, same situation, different you. Stress Care can be found at fine health food stores everywhere or online at HimalayaUSA.com.
Novocaine, baby, baby. Novocaine, baby.
Hey, glad you're here. You're listening to the Healthy Home Hour, sponsored by the Healthy Home Market. And we're here today with Dr. Jessica Schorr Saxe, MD, who's been in Charlotte for a long time, helping all kinds of folks, taking care of the underserved and folks you might know. Maybe it's you. And she has also devoted much of her time to the idea of the single payer plan for health care, which we've been talking about this hour. And before the break, we were talking, Dr. Sachs, about the idea that how different it would be if you just had a card and you could, like you mentioned, France. You can go, there you are, you're in France, and you have this card, and you just swipe it, and everything's taken care of. You don't have to agonize over the bills and lose sleep and time about it. But somebody's going to be thinking, it kind of makes you wonder, well, how will that be overseen, making sure that there's no abuse in the system?
Well, as I mentioned earlier, there's going to be a public board. I mean, there will have to be oversight, right, obviously, and that there's no abuse by providers and, all kinds of people.
Right.
But again, it will be public representation looking over this rather than a private company that doesn't have any public representation.
I bet when you see patients, you must hear an awful lot about how difficult it is to maneuver through the system, and perhaps even yourself.
Oh yes, it's terrible, and people don't realize it. And in my practice, it was very complicated because patients didn't understand it, but the physicians didn't understand it either. And one of the things about practicing in this country is that you have patients, and they all have different payer sources. So you have patient with this private insurance, that private insurance. You have some patients with Medicare, some patients with Medicaid, and then we had a lot of patients that were uninsured. So one of my friends said she had to practice with an algorithm in her head. So you have so-and-so come in and you figure out which their payer is, and then that leads you down, well, then they can have this, or then they can go to this person but not that person. No. And then we have to find, they don't have insurance, so they can't go to any of these people, so then we have to figure out a trick. And because I practice with a lot of low-income people and a lot who are uninsured, I felt like I had to have a bag of tricks. And what kind of way is that to deliver health care?
Yeah, and it doesn't allow you, I wouldn't think it would be easy to really connect every time the way you want to connect with your patients. You must be caught up to some degree.
It's a terrible barrier.
Right.
And it's a terrible barrier to have a patient there who needs something, and you think to yourself, well, if only North Carolina had expanded Medicaid, they would be eligible for the knee replacement that they need. And if they got the knee replacement, they could walk. Maybe they could go back to work, but they can't. And there isn't anything I can do about it. And that's really, it's a huge barrier, and it's a huge distraction and interference with the relationship with the patient.
Sure, I can imagine. How about the taxes to get this done, to do single payer?
So you asked what was in H.R. 676.
Yes.
And it does describe the way that it will be funded. And the funding is through the tax system. The specifics are that it's a variety of small taxes. There's a tax on employers, a payroll tax that employers pay. There's a small income tax, and there are some taxes on stocks and bond transactions. So then the next question you're going to ask is, oh my gosh, nobody wants to be taxed. Isn't that terrible? But you think about the trade-off, and the trade-off is you're not going to pay insurance premiums. You're going to be able to seek medical care, and you're not going to have co-pays, deductibles, co-insurance, any form of cost sharing. And for almost every single person in the country, they are going to be spending much less on health care. Not to speak of getting better care, but also spending much less than what they are spending now.
This HR, this 676 bill, you're saying there's no premiums, there's no deductibles, co-pays,
correct,
co-insurance. Then, some folks say that it might encourage people to use healthcare irresponsibly, that they won't practice wellness. Do people need to have the proverbial skin in the game?
Oh, thank you so much for raising one of my favorite topics and my least favorite expressions.
Right. Sorry.
But I'm really glad that you asked the question. People talk a lot about the skin in the game. The skin in the game, by the way, I heard that so much I looked it up, and it's actually a financial term. It had to do with people investing in their own companies so that when they encourage other people to invest, people see that they're going to make it productive, so that they won't lose their own money. It's been used in financial terms, but in healthcare, people have transferred that term, but there's no evidence for it. The evidence is that if you charge people, people will defer healthcare. However, they don't distinguish between what is elective and what is really needed healthcare. They will put off or not get things that are needed just as much. Needless to say, this is particularly true of people who are poor or vulnerable, that they are more likely to do it. And so people need healthcare. 1 in 3 people in this country does not get some form of needed health care because of financial reasons. That means they don't go to the doctor when they're sick, or they don't fill a medication, or they miss something, that they don't go and get something that was recommended from their doctor for financial reasons. And that includes, by the way, about 1 in 3 people who are privately insured. So if you ask me about the epidemic in this country, the biggest epidemic is of people not getting health care they need.
So you're talking things like, people aren't getting some tests and they're not getting basic physicals. And so they may, it does sound like it would be a big cost savings, because over time, if somebody found out that they had a small little cyst that was cancerous in their breast, they could handle that much more easily than 3 years, 5 years down the road. Now it's metastasized all over, and that's not a good outcome.
Exactly. And one of the good things about the Affordable Care Act is that many preventive procedures are covered. Now, that's good for the people who have health insurance. The Affordable Care Act doesn't do anything for the people who didn't get insured, but that's good. But what I want to do is expand a little bit about what you said about what is prevention. For somebody who has high blood pressure or might have high blood pressure, if they go to the doctor and they get on medication, or the doctor discusses lifestyle changes that'll help their blood pressure, and they get it under control, that will benefit them later on. That may prevent a stroke that they have later on.
Right.
But that's the kind of preventive thing that's not, automatically covered at 100% under the Affordable Care Act. It's what we call secondary prevention, because they already have a health condition, but they would benefit by seeing somebody to prevent a worse health condition. And there are a million things like that people need to get health care for, and they need to go in and they need to get it, and they need to not have a $5,000 deductible that discourages them from going and having a doctor visit.
Lots of our listeners would like to know about the single payer plan. Might it include complementary medicine like acupuncture or chiropractic or naturopathy and things like that?
Yeah, and the way that that's looked at is that there will be studies that look at some things and to see whether they're effective or not. And the general thought is that those that can be proven to be effective will likely be covered. I don't think that is mentioned in the bill. The bill is short. It's just 30 pages, and this is the kind of thing that would have to be expanded, but that's the general thought.
Yeah, it's interesting because, one of the things that I've experienced myself, and I hear it all the time at the Healthy Home Market, is that sometimes you get a diagnosis or thought about tests that you're just not going to get better past a certain point. And when you hear that, some people accept it and others start studying and getting to a health food store like the Healthy Home Market. Do you think that a single payer plan could actually open barriers between allopathic medicine and alternative methods that really were practiced, before the AMA got started?
I think it's possible. I mean, I think I'd like to see us get to single payer and then start talking about all those issues, because those issues will come up.
Yeah, and you mentioned earlier mental health and dental, and there's something like 1 in 3 women and 1 in 4 men, I think, that I have read that are on antidepressants in the U.S. And we've got serious addiction problems of all different stripes. Do you see any new approaches or potentially effective approaches to mental and emotional health now, even not even talking about single payer? Are there new things coming? Is it getting better?
Well, do you have another couple of hours for that?
Well, we can
over this conversation. I hope that it's getting better. There are many things. There are many people in this country who are depressed, but much depression goes undiagnosed, and much of it goes untreated. I mean, those are definitely things that we need to address. We need to address the stigma of these things. People who have mental health issues and people who have addiction issues all need to be able to get into the health care that they need, which relates to what we're talking about here.
Right. I'm wondering, there's so much in the media right now about the candidates looming out there, and there's some crazy candidates, and then there's some other candidates. And is there any candidate out there right now that's going to be running for president in 2016 that is interested in the single payer plan?
Well, Bernie Sanders has said that he's been a longtime supporter of single payer, and he's put it in his platform. But I'm not here to endorse any candidate.
I understand. No, I wanted to know that so people know. And how, overall, it sounds like this would be great for Americans and charlatans. And I know, we really are our brother's keeper in some way. It's important that we take care of each other. And I'm wondering what you would like listeners to do. How can we help you move this forward?
Thank you very much for asking that question. I hope all your listeners will go look at the Healthcare Justice North Carolina website. And we have a resolution in support of single payer on the website. You can sign that. It automatically makes you a member. We don't have a fee for joining. And then you have the privilege of getting updates from me periodically, where I send articles of interest, which I screen carefully. I want all your readers to know. And I also let people know about upcoming events and things that we think people should support. If your listeners want to educate themselves further, there is pnhp.org. That's Physicians for National Health Program, which has all the information you could possibly want, all the data, and all the arguments that you can then use with your friends who bring up these issues.
Wonderful. Well, thank you so much for being here today. I really appreciate your work and your expertise and your focus and helping. And what would you like?
If you could repeat the website again.
Absolutely. We've got to do that. It's pnhphcjnc.org, or you can Google Healthcare Justice North Carolina and see what Dr. Jessica Schorr Saxe has been up to. Thanks so much, folks, for being here. Thank you, Dr. Saxe. And until next week, I'll see you you are welcome. And see you at the market. I'll be looking for you at 1330 Central Avenue, right there at the Healthy Home Market. Peace out, y'all.
Pay it forward and restore yourself by making the healthy choices for you and your family, and enjoy life with the Healthy Home Market. Feel the goodwill and own great health. Check it out at healthyhomemkt.com. That's healthyhomemkt.com for store locations, details, and discounts. Get the best of God's green blue earth at the Healthy Home Market.